The first five bones that we're going to palpate for the shoulder are the spine of the scapula, medial border of the scapula, inferior angle, the acromion, and the deltoid tuberosity. First, I have my partner laying down prone, and also with a rolled up towel or a t-shirt right underneath his left shoulder. Raise your shoulder up real quick. There we go. Thank you. Now, what elevating this shoulder does is it raises the scapula from the ribs. To find the spine of the scapula, we first palpate the deltoid region, the posterior deltoid. The posterior deltoid is originated from the spine of the scapula. Now, as I'm following the muscle fibers, I reach the spine of the scapula. You can tell because it feels hard to the touch. The spine of the scapula also, just at the crest of it, there is no other muscle that is superficial to it. Now, as I'm palpating, I can feel the spine of the scapula. Now, the next muscle that we are going to palpate and find is the medial border of the scapula. The medial of the border of the scapula runs parallel to the spine, which goes down over here, and you can actually follow it by you can find it by following the spine of the scapula down to the medial border. Now, as I'm following it, the spine of the scapula, you see it ends right when you become medial towards the spine, towards the center of the body, and it turns. You can either go superficially or inferiorly. Inferiorly, we can follow it all the way to the inferior angle, which is the next bony landmark we're going to find. And if you follow it superiorly, you find the superior angle of the scapula. Now, there is a muscle that is over the spine, spine of the medial border of the scapula, which is the trapezius. But you can still feel it. It's hard to the touch. The next muscle that we're finding is the inferior angle. As we're following the medial border of the scapula, you can actually see the inferior angle. It turns laterally, and you can follow it all the way to the lateral border of the scapula. Now, when you're palpating, you can actually feel the teres major bump that originates from the inferior angle. The next muscle that we are finding is the acromion. I will have my partner sitting upwards. We are now going to find the acromion. The acromion, you start by finding the spine of the scapula. Again, we palpate the posterior deltoid and follow to its origin, which is the spine of the scapula. Now, we use the spine of the scapula to palpate upwards, and you'll feel the bone hard to the touch over here. It is a superficial surface where the medial and anterior deltoid originate. Did I say that right? Now, if I choose to continue to follow it, I can follow it all the way to the clavicle, to the acromioclavicular joint, which is over here. This is the acromion. The next muscle that we are going to palpate is the deltoid tuberosity. The deltoid tuberosity is your insertion point of the middle fibers of the deltoid. Now, I'm going to have my partner chest high, chest in, retracting the scapula, and in a comfortable position with his head in its neutral position. There we go. So now to find the deltoid tuberosity, we are palpating from the acromion down to the belly of the deltoid to the mid shaft of the humerus. Now, as we're following, this muscle is the attachment point to the insertion point of the belly of the deltoid, and the belly of the deltoid ends over here. Muscles that we are going to palpate for the shoulder and arm are the biceps brachii, subclavius, pectoralis minor, pectoralis major, serratus anterior, and belly of the deltoid. First, for the bicep brachii, I'm going to have my patient / partner seated over here with his lateral side of the body facing laterally towards the camera, which you're doing fine right now. I have my patient seated and I'm holding his hand. Relax. Gently. Excuse my hand, bro. There we go. With his elbow slightly flexed. Bicep brachii is consisted of two muscles, one laterally and one medially. If I have my patient have resistance against the force of my hand, which causes his elbow to flex. Okay, now down. I'm going to apply pressure downwards, and you go against the resistance. You can see the muscle tense up. Arms, I'm going to apply resistance to his hand, so his hand is applying resistance to supination. So I'm going to go the other way, and you're going to apply resistance to supinating. So I'm going this way. So you're supinating.
Okay.
Again, the patient is not flexing his elbow. I am applying a resistance so the patient's hand would pronate, whereas he's applying pressure where his hand would supinate, which is causing this muscle to flex. So for the next muscle, we are going to palpate the pectoralis minor. I have my partner laying down sideline. I'm going to support his hand with a flexed elbow. Now I'm going to try to palpate. Now I'm going to bring the hand anteriorly. What this does, it lifts the pectoralis major off of the chest. It makes it easier for my hand to curl around underneath the pectoralis major muscle. Tell me when it hurts. That hurts?
Yeah.
Now, I'm going to have the patient do a slight depression of the scapula, and I will feel the pectoralis minor muscle contract. Go ahead. Yep. And I feel the muscle's fibers strengthening and loosening up. The next muscle that we are palpating is the serratus anterior. I have my patient laying supine on his back. First, what we're going to do is we're going to abduct the arm slightly and then flex the shoulder, supporting it with his hand. His body is still completely relaxed right now. I'm the one holding his hand up. Now the serratus anterior is between the pectoralis major, which you can see over here. You can follow the line, palpate it, and between the border of the lateral border of the latissimus dorsi and the medial border of the pectoralis major. You can rest your hand on my shoulder. Now to feel it, I would just run my fingers perpendicular to the rib cage and I will feel the muscle palpating. Next muscle that we are going to palpate is the pectoralis major muscle. I'm going to have my partner laying supine on the sofa. I'm going to slightly adduct my partner's shoulder and hold his hand in his elbow in his flexed position. I'm going to find the medial shaft of the clavicle and run my fingers down to the muscle fibers of the pectoralis major muscle. I'm going to run my fingers down where it blends into the deltoids, specifically the anterior deltoid. Now I'm going to press my thumb into the axilla of the underneath the pectoralis major muscle and have my partner go against the resistance of my hand pulling towards me. Therefore, my partner is going to do an isometric contraction of the medial internal rotation of the shoulder. Now I feel the whole pectoralis major muscle contracted. There we go. Do it one more time. Your hand was in the way. One more time. Okay. Good. Next muscle that we're going to palpate is the belly of the deltoid. What I'm going to have is my partner sit up. As my partner is sitting up, I'm going to flex his elbow in a 90-degree manner. And what I'm going to find is the deltoid tuberosity, which is this V shape right over here, ends over here. Now you can see there are three parts of the deltoid. There's the anterior fiber, posterior fiber, and the middle fiber, which is the belly of the deltoid. As I follow up, I can feel the insertion point of the deltoid, which is the acromion. To feel the shoulder flex, I'm going to have my partner push into my hand. So he's doing the isometric abduction of his shoulder. Now you can actually see the fibers and the division between the anterior and the middle deltoid. Right over here. 5 bony landmarks that we are going to palpate are the olecranon process, the medial and lateral epicondyles of the humerus, the shaft of the ulna, the shaft of the radius, and the head of the ulna. The 5 muscles that we're going to palpate for the wrist and hand are the brachioradialis, the brachialis, the extensor group muscles, the flexor group muscles of the wrist, and the supinator. For the olecranon process and fossa, I'm going to have my partner sitting with his shoulder facing laterally towards the camera. So for the olecranon process, I'm going to shake my partner's hand. So 90 degrees, and there's going to be a knob right at the tip of the elbow. That is the olecranon process. Now what I'm going to do is I'm going to flex and extend, flex and extend. Once I extend, I can feel the muscle fibers contracting proximal of the olecranon process. For the olecranon, there we go. For the olecranon fossa, we're going to again shake the partner's hand, and we're going to find the contracting tendons of the tricep on the olecranon process. And the fossa is right under deep to the tricep tendons right over here. Okay. That was one. The next bony landmarks that we're going to look at is the medial and lateral epicondyles. First, we're going to find the medial epicondyle. I'm going to shake my partner's hand. I'm going to find the olecranon process and shift my hands medially. There is a ditch, and then it rises more like a bulbous state. That is the medial epicondyle. I go back to the ulnar process and shift my hands laterally. There's a ditch, and then it rises. Now, that is the lateral epicondyle. When I flex and extend, the lateral epicondyle does not move. When I flex and extend, the medial epicondyle does not move. Next, I'm going to find the shaft of the ulna. I'm going to shake my partner's hand, find the ulnar process, and shift my hand, slide my hands distally along the forearm. The shaft of the ulna is deep to the muscles, right distal to the olecranon process. However, the bone starts protruding around midway of the shaft. You can feel it over here. As I'm leading, we then find the next bony landmark, which is the head of the ulna. The head of the ulna is right proximal to the wrist over here, and has, like the epicondyle, has a bulbous state. The next bony landmark we're going to find is the head of the radius. Shake my partner's hand. We're going to find the lateral epicondyle from the olecranon process, and we're going to shift our thumb distally onto the head of the humerus. Head of the radius. Now, we supinate and pronate, we can actually feel the bone rotate, which is distal to the lateral epicondyle. Yep, right there. Cool. Right. Now we are transitioning on to the muscles of the wrist and hand. For the brachialis, I'm going to have my partner sitting, and I'm going to shake his hand, causing a 90 degrees flexion of his elbow. I'm now going to isolate his bicep brachii by having my partner do an isometric contraction, elbow flexion contraction against my resistance. So you go against my resistance. Yes. Right, you can relax. Okay. Now that the belly of the bicep is isolated due to the resistance of my hand, we're going to go to the distal part of the bicep brachii and go laterally. Go against my resistance. And relax. There it is. Once I feel a thump, that is the bicep. Once I feel a thump, that is the brachialis. I can follow the brachialis all the way distally, where it transitions into tendons. When I'm following the brachialis, I see that it is lateral to the bicep brachii, and in between the bicep brachii and the tricep tendon. The next muscle that we're going to palpate is the brachioradialis. I'm going to have my partner's elbow flex in 90 degrees, and instead of shaking my hand, I'm actually going to have his fingers flexed with his thumb facing towards the ceiling. Have this 90 degrees. 90 degrees. A little back. There we go. Now I'm going to apply resistance down, where he's going to be isometrically contracting, flexing his elbow. Now I'm going to apply pressure, and he's going to be isometrically flexing his elbow. Once this happens, you can clearly see his brachioradialis bulging. Once palpating, once palpating, you can see that this muscle is superficial and bulging out laterally from the lateral epicondyle. Okay. Next, I'm going to find the extensor group of the forearm. I'm going to have my partner seated. I'm going to shake my partner's hand with 90 degrees. I'm going to have my partner's hand in a supine position. I'm going to find the brachioradialis and shaft of the ulna. And then I'm going to find the middle point between these two muscles, between the muscle and the bony landmark. Now what I'm going to have my partner do is extend his hand, extend his wrist while I'm applying pressure to it. So do you know how to extend your wrist like this?
This way.
Yeah. And I'm applying pressure.
Mm-hmm.
And then relax, and extend, and relax, and extend, and relax. Okay. Now I am in between the epicondyle and the shaft of the ulna. Whenever my partner extends, the muscles contract and relax. Okay. Next, we're going to find the flexor group. I'm going to have my partner seated, and I'm actually going to use his other hand. Yeah, that's fine. Since the origins of the flexor group is in the medial epicondyle, therefore, I have this partner seated in this direction so the camera can see. I'm going to have, like the extensor group, I'm going to have my partner's hand laying supinated. I'm going to find the brachioradialis and the ulnar shaft. Place my hand flat between these two groups. Now, instead of extending, my partner will flex his hand and relax. And relax. And relax. And relax. Oh, there we go. And relax. And relax. And relax. Okay. Flex. And relax. Palpate. And relax. Flex. And relax. Flex. And relax. Okay. I'm in between the brachioradialis and the ulnar shaft, and when I ask my partner to flex his hand, I can actually feel the muscles contracting. So flex one more time. And relax. Flex and relax. Next we're going to find is a supinator. I'm going to have my partner sitting up, and I'm going to have his elbow flexed in a 90-degree position. What I'm then going to do is I'm going to find the shaft of the radius, the proximal end, and the lateral epicondyle. I'm going to find the medial part of it and lay my hand on it. Now the supinator is deep to the extensor group. Now what I'm going to have my partner do is supinate against my resistance of my hand. And relax. Supinate. And relax. Supinate and relax. And there it is. Supinate and relax.